Okay, class, this is our third video in the Introduction to Anatomy. There will be just one more, so we're almost done. Make sure you have your worksheets out so you can complete those after you listen to this video. Make sure you understand what is going on. So today, this video is going to be covering body cavities, abdominal regions, and abdominal quadrants. So let's get started with body cavities. In anatomy, when you hear the word cavity, always think of a space. There is going to be something in that space. And for the most part, it's going to be organs. And so body cavities are where we're putting in organs and we're trying to protect them in some way. In anatomy, we have two principal locations of our body cavities: the dorsal body cavity and the ventral body cavity. You already know where this is located, right? Where's dorsal? Dorsal's on the back side. Where's ventral? Ventral's on the front side. So this diagram is showing you the location of your dorsal body cavity and this is your ventral body cavity up front here in the red. So we're going to be starting with the dorsal body cavity. It's easy to understand, not that hard. The dorsal body cavity contains two cavities: the cranial cavity, which houses the brain, and a continuation of the cranial cavity is going to be the vertebral cavity, which is housing and protecting the spinal cord. So let's look at that dorsal body cavity a little bit closer. So that cranial cavity, the dorsal body cavity, that just tells you the location. These are on the back side. The first one is the cranial cavity. It's a bony cavity that is surrounding and protecting the brain. This is all hard bone. Here's showing you the cranial cavity. It's taken the top off of the cranium. There is the brain. Now, what you need to understand is the brain is not like rubber. The brain is like jello, soft jello that's just set. It can be easily damaged, so we are putting it in this hard, bony cranial cavity to help protect it. This is where the brain is sitting. This is the inside of the cranial cavity, and you'll notice a hole right here. This is where the spinal cord is actually going to be leaving the brain. The brain and the spinal cord are all continuous structures. Here's the underside of the skull. So this big hole here is where the spinal cord is coming out. The spinal cord is going down the vertebral cavity down here. This picture's pretty small, let's see. And there's going to be a space in this bony vertebral cavity where the spinal cord is going down. Here's showing you this hole right here. This is where the spinal cord is going down. So it is protected by this bony ring all around it. Same thing, the spinal cord is soft and mushy, just like the brain. So they need this hard, bony protection. So that is the dorsal body cavity. Easy wheezy. Now let's get into the ventral body cavity. Now the ventral body cavity is right here. It's all in the front. It's in front of the vertebral column. So we are going to have different parts of the ventral body cavity. We're going to have this upper portion called the thoracic cavity. Here it is. Here's the thoracic cavity right here. There's going to be this huge muscle that we talked about briefly, the diaphragm. The diaphragm is separating the thoracic cavity from this abdominal cavity. And inferior to the abdominal cavity is going to be the pelvic cavity. The pelvic cavity is deep within the pelvis here. So let's start with the thoracic cavity. First, I want to show you these pictures. These are great pictures. So here's your thoracic cavity. We have the bones, the ribs, and the cartilage. This is all cartilage up front here. Here is your breastbone, the sternum, right in the middle. So we have this plate of bone and cartilage wrapping all around the thoracic cavity. And those ribs connect all the way back to the vertebral column back here. So it is completely enclosed in bone and cartilage. Then we have this huge, huge diaphragm. This is your breathing muscle. So you can see how this diaphragm is separating, completely separating the thoracic cavity from the abdominal cavity below. You do not want your stomach going into your thoracic cavity. So diaphragm, you must know that. You must know the diaphragm is what separates the thoracic cavity from the abdominal cavity. So here is our classroom models. So they have taken off the bony part of the thoracic cavity so you can see the organs that are contained within it. Now, within the thoracic cavity, we have two pleural cavities. Now, these pleural cavities each contain a lung. So we have one pleural cavity here and another pleural cavity here. They are surrounding the lungs. We will talk about those pleural cavities in our next video, but for right now, just know that within the thoracic cavity, there are two pleural cavities, each containing a lung. And in between the two pleural cavities, we're going to go to this picture, this torso model. Here they've done a frontal or coronal section of the lungs, so you can see deeper into this area. We're getting a back picture of this part of the thoracic cavity. In between the two pleural cavities, remember the pleural cavities are surrounding our lungs, we're going to have this region right here. This region that's starting from the clavicle up here, and it's going to have its front border will be the sternum up front and the vertebral column behind it. This region right in here is called the mediastinum. Mediastinum. A lot of students get confused with what the mediastinum is. The mediastinum is this area in between the two pleural cavities, extending from the sternum up front, the vertebral column, the backside, up to the level of the clavicles up here and the diaphragm below it. That is the mediastinum. It is this region. Now, within this region that we call the mediastinum, we are going to have some structures. This tan structure here is the esophagus. This is the tube. This is the tube that is delivering food from the back of your throat, and it's going to go through the diaphragm and take that food to your stomach. So the esophagus, part of the esophagus is in the mediastinum. Then there's your air tube, this big air tube that is taking air in and out of your lungs. This is the trachea. You don't really need to know that right now, but this air tube that's taking air in and out of your lungs is within the mediastinum. And then we have these huge blood vessels. We call these the great blood vessels. They are taking blood into and out of the heart. So all those structures I just listed, the great blood vessels, the air tubes, the esophagus, are within this region called the mediastinum. And what else is in the mediastinum? This guy. The heart is located within the mediastinum in its own pericardial cavity. Peri means around, cardi means heart. AL tells us it's an adjective. So this is a cavity that surrounds the heart, just like the two pleural cavities surround the lungs. So we will talk about the pleural and pericardial cavities on our next video. So within the thoracic cavity, one more time, we have two pleural cavities that each contain a lung. In between the pleural cavities, we have this region called the mediastinum. Media, in the middle. Within the mediastinum, we have structures like the trachea, the air tube, the esophagus, and the great blood vessels that take blood to and away from the heart. And we have the pericardial cavity that will be sitting in here, and it will surround the heart. Hopefully that makes sense. Here's another picture. This is showing you the pleural cavity. It's outlining this lung here. Excuse me. Here is one lung, the right lung, and the left lung. They are each within a pleural cavity. This is showing you an empty mediastinum. There's nothing here. But remember, within the mediastinum is going to be the esophagus, the trachea, the great blood vessels of the heart, and of course the pericardial cavity that contains the heart. Notice also that the pleural cavities sit right on top of this diaphragm. The pericardial cavity, which is going to be here, but they don't show it, is sitting right on top of the diaphragm also. So now let's go down into our abdominal cavity. So, the abdominal pelvic cavity. This is inferior to the thoracic cavity. And you must remember it is the diaphragm that is separating them. The abdominal pelvic cavity is separated into two parts. The superior cavity is called the abdominal cavity. That is going to be this part just inferior to the diaphragm. And then the pelvic cavity, which is deep within the bony pelvis. This is the pelvis here. So the pelvic cavity is deep within this bony pelvis. Now, there is no true separation between these two cavities. We have the bony pelvis, but there's not a complete separation like there is with the diaphragm. The diaphragm is a complete separation. And I want you to look at this abdominal cavity. Now, we said the thoracic cavity, these structures that are in the thoracic cavity, they are protected. What are they protected by? We've got the bones here. We've got the sternum, the breastbone. We've got all our ribs. We've got all this cartilage. And there's going to be muscle, too, throughout here on the chest that's going to protect these structures. What is protecting the abdominal cavity right here? Do you see any bony structures down here that are going to protect the abdominal cavity? No. So the abdominal cavity is somewhat vulnerable. You have muscle overlying it. You have skin. And depending on how much fat you have some fat that could give you some protection too. But otherwise, there's no bony protection for the abdominal cavity. Now this pelvic cavity, so we're talking about deep within the pelvis, it's going to be, the organs in this pelvic cavity are going to be somewhat protected. That includes the bladder, the internal parts of the female and male reproductive systems, and the lower portion of the large intestines, the rectum. Those are going to be sitting deep in this pelvic cavity. Let's start with the abdominal cavity and look at all these organs: liver, gallbladder, stomach, spleen, pancreas, small and most of the large intestines, and the kidneys. So here is your torso model in the classroom. Always remember, this is right. You are looking at the model. You are facing the model. This is always right. This is left. Here is the diaphragm. They're showing you this is the diaphragm. Here is the liver. The gallbladder sits just under the liver. Here is the stomach. Here is the spleen over in this corner. Here is the large intestines. All this gray stuff is the large intestines. And this is all the small intestines. If we remove the liver and the stomach, we're going to see a better, you can see the spleen better. Here's the pancreas. The pancreas is deep. The pancreas is deep to the stomach here. So here's the pancreas right here. Here is the first part of the small intestines. This is the duodenum. And here are the kidneys back in here. And deep within the pelvis, you're going to have these structures. So now we are deep in the pelvis. So this is going to be the pelvic cavity down here. Here we see the bladder, and this is the rectum going behind the bladder here. This is a male, this is a female, so here you have the uterus that sits on top of the bladder. You have the ovaries, and here's the rectum. Here is where the esophagus is entering into the abdominal cavity through the diaphragm. So the esophagus would be connecting to the stomach right here. We have so many abdominal organs. We need to get them organized and divide them so we can talk about them clinically. So if a patient comes in to see you, we can use words that will help describe where the patient's pain is and what organs, depending on where the pain is, what organs might be involved. The first method that we divide our abdominal pelvic area is through what we call quadrants. Quad means 4. We are going to we are going to divide the abdominal pelvic area into 4 sections. We are going to go right through the belly button. That's going to be this horizontal line, and then right down the midline, we're going to draw a vertical line. So now we have 4 quadrants. 1, 2, 3, 4. Remember, this is the right side, this is the left side. This is going to be the right upper quadrant, right lower quadrant, left upper quadrant, left lower quadrant. Now, if you remember the torso, what was almost the entire right upper quadrant was taken up by what organ? This guy. The liver. The liver is huge. It's your largest internal organ in your body. Huge. So the main organs that you're going to be concerned about if a patient comes in and has right upper quadrant pain is going to be, the liver or the gallbladder that lives right underneath it. And depending on the history that the patient is giving you, maybe they only have pain after they eat fatty foods. Otherwise, they don't have any pain. You're going to think of gallstones. Or if they have chronic right upper quadrant pain and they are an alcoholic, you're going to think of alcoholic liver disease, hepatitis. So right upper quadrant. Right upper quadrant. That's how you abbreviate it, RUQ. Patient comes in with right upper quadrant. That's how you're going to write it in the chart. Pain. Immediately you're going to think of these organs, liver and gallbladder. Right lower quadrant. Patient comes in with severe right lower quadrant pain. Now we've got lots of intestines and large intestines down here, but the big guy that is you got to think about clinically is the appendix. The appendix, this little guy right here, lives in the right lower quadrant. So if patient comes in with severe right lower quadrant pain, you're always going to think of the appendix. Left upper quadrant, what lives up here? It's basically the stomach and the spleen. Now the left lower quadrant, there's nothing specific to this region. You have lots of large and small intestine, but when you have intestinal pain, it is usually pretty diffuse because you've got 20 feet of intestines here. So these are the big guys. Right upper quadrant, liver, gallbladder. Right lower quadrant, the appendix. Left upper quadrant, stomach and spleen. Those are the clinically important organs in those quadrants. Another way to divide these is by regions. So they're going to divide it into 9 different regions. For my class, you only need to know the ones that are clinically most relevant and used. It's going to be these 3 middle regions. So all you need to know if you are in my class is this epigastric region, the umbilical region, and the hypogastric, aka suprapubic region. This is what we're going to be concerned. We're going to just look at these 3 regions right here. So here's our torso model. I took out the liver and the gallbladder and the stomach. So this is the regions we're going to be concentrating on. This upper region, epigastric region. Epi means what? Remember, epi means on top of, over, above. Gastric is related to the stomach. The stomach would be right here. So when we took it out, here's the esophagus, but the stomach's going to be connected to the esophagus right here. If the patient comes in with epigastric pain, you are going to be thinking of stomach. The lower esophagus. This is the distal esophagus. The lower part of the esophagus. Could you have some reflux where the esophagus is being irritated with acid and you're getting burning esophageal pain? Could you have a gastric ulcer? So that would all be in this epigastric region. Also within the epigastric region is going to be this organ that will give you intense pain. This is the pancreas. Now pancreatitis, itis means inflammation. If you have inflammation of the pancreas, that is severe pain. Patients can die of pancreatitis. So epigastric pain, you're going to be thinking of the stomach, the lower esophagus, and possibly the pancreas, and the first part of the small intestines, which is the duodenum here. This umbilical region, which is the area around the belly button, same thing. The main organs you're going to think of, again, is going to be this pancreas. Patients will say it's like pain, like a knife going from their belly button straight into their back. And then the duodenum, the first part of the small intestines, you can get a duodenal ulcer. These ulcers are real common because there's getting acid from the stomach is being dumped straight into this first section of the small intestines. So umbilical region, small intestines, and the pancreas. Then you get down to this region. Hypogastric region. Clinically, no one calls it the hypogastric region. I've never even heard it called that region before I started teaching anatomy. Could the umbilical region be hypogastric? Hypo means what? It means below. So technically this could be the hypogastric region because it's below the epigastric. It's below the gastric. Anyway, if you want to remember this, you can. But if you are going to go into the healthcare profession, they are going to call this the suprapubic region. Supra, above the pubic. The pubic bone is going to be about right here. The suprapubic region. This is where you're going to have your bladder. Male or female. You're going to have a bladder here. You're also going to have the female uterus and ovaries here. You're going to have the male prostate is within this region. You also have the distal end of the large intestines, the rectum back here. So this suprapubic region, if you have a patient coming in, say you have a 23-year-old female coming in complaining of pain with urination. Every time she pees, it hurts. And you do an abdominal exam, and when you are palpating, meaning you are checking her abdominal area, you palpate over this area and she has suprapubic pain, you're probably going to think she's got a bladder infection. So these are the three regions I want my class to know: epigastric, umbilical, and the suprapubic region, and know what organs are clinically the most important for these regions. that's it for this video, I think. Yep. So the last video will be on our serous membranes. So see you soon.